Kia ora koutou katoa. Good afternoon. Before I begin today, a quick overview of decisions that will be announced over the coming week. Today I'll set out two decisions Cabinet has made around COVID-19 alert level settings and booster vaccines. On Wednesday, we'll announce the date for greater movement at the Auckland boundary. That same day, schools in Auckland reopen. And this week, we will also release details on how to obtain your vaccine certificate in preparation for the move to the COVID-19 protection framework. Next Monday, we'll review restriction settings for Auckland. Today, though, we have a review of settings in the Waikato as part of which moved into level 3 6 weeks ago. Since that time, there have been 239 cases. The people of the Waikato have helped to keep those numbers low and restricted to mostly within households, which is, we know, one of the top spots for Delta spread. The people of the Waikato got tested. In fact, the region has the second highest rate in the country. And most importantly, they got vaccinated to keep each other safe and are just 3,893 doses away from reaching the milestone of 90% first doses. Overall, since the early stages of lockdown for the Waikato, over time we've taken a stepped approach to easing restrictions. That has not thrown up any unexpected spread. Wastewater testing has shown a low likelihood of wider community transmission. In short, the people of Waikato have contained an outbreak that could have moved much more widely throughout the region. And so today, Cabinet agreed on the advice of the Director General of Health to move Waikato to Alert Level 2 tomorrow, Tuesday the 16th of November at 11:59 p.m. A reminder that Level 2, you can go to work, back to hospitality, schools are open and events can go ahead. Sports can also resume. But those health measures of distancing, masks and scanning in remain paramount. If you have any cold or flu type symptoms, please get a test. In making this decision today, Cabinet was very clear it is a temporary one. In fact, that is true for all of New Zealand. As we've said, we're keen to move very soon into the new COVID-19 protection framework. The reason for that is because it's designed for scenarios where COVID is in the community, much more so than the alert level system, which we created when there were no vaccines and no way to safely combine public health restrictions with cases. In some ways, the COVID-19 protection framework provides more safety than even level 2 of the alert level system. For example, currently in a region at level 2, everyone can go to a hospitality setting, vaccinated or not, with the level 2 key restrictions of a maximum of 100 people seated and separated. However, at red and orange in the new framework, you'll also need to be vaccinated, which adds an extra layer of protection. Cabinet discussed this today in light of the fact that we are seeing more cases pop up beyond the Auckland border. While we will have decisions on when we'll move till the November the 29th check-in, we are seeking public health and expert advice on these decisions and the advantage of the country moving into the COVID protection framework early. We come now to boosters. An eligible population now at 90% first dose and 81% fully vaccinated, we are amongst one of the most vaccinated countries in the world. And we can keep ahead of the pack again by rolling out boosters. Boosters are a belt and braces approach. Lifelong protection from vaccines is not always possible, and we see that in the likes of tetanus boosters. The science has shown us that providing a booster 6 months after the primary course essentially tops up immunity levels back up to the mid-90% mark, reducing the risk of severe disease and therefore the burden on our hospitals. They also help to protect against any future variants by boosting an individual's overall immune response. That's not to say that the vaccine becomes ineffective after 6 months, not at all, but boosters keep it at the top of its game. Last week, MedSafe approved the use of our Pfizer COVID vaccine as a booster dose for people aged 18 and over, with a minimum 6-month interval between their second dose and a booster dose. And so today I can announce that we will roll out a booster vaccination program with doses being administered from the 29th of November. The rollout of boosters will be simple. Basically, anyone who's been fully vaccinated 6 months or more ago can get a booster. Our focus, though, will be encouraging those most at risk of COVID, including health workers, border workers, and our Māori and Pacific communities. We'll also be making sure older people in kaumātua, including people in residential care, have good access to booster doses when they become eligible. While most other countries are rationing boosters to certain segments of their population, we've made the decision to make boosters available to everyone 6 months after their primary vaccine course, most of which will naturally happen in 2022. That ensures simplicity and it ensures equity. There are currently 144,000 people in New Zealand who have been vaccinated for 6 months, and 455,847 in total will be eligible for a booster by the end of the year. So a reminder, you don't need to rush to get this done. If you've been vaccinated, you're still really well protected from infection and from being seriously ill if you get COVID. Pfizer protection, for example, ranges from 85 to 93%, and its effectiveness against severe disease or hospitalisation is for 80% plus. Last month, we secured an extra 4.7 million doses of Pfizer for 2022. We also recently approved the use of AstraZeneca for those who are unable to have Pfizer. The supply is enough even if in the future vaccine eligibility extends to 5 to 11-year-olds, or we have a surge of people getting vaccinated or having boosters. See from these decisions that we continue to move forward in our plan to manage COVID-19. And this week you'll see a progression of government decisions that propel us forward further still. When COVID reached New Zealand almost 2 years ago, our goal was simple: get cases to zero by staying at home. And we did. And we avoided the worst of COVID, the death tolls and the economic difficulties experienced by so many others. But no country has escaped Delta altogether, nor would we. But we bought time by keeping some restrictions in play as we accelerated vaccination. This has worked. Even now, with the highest cases we've seen to date in New Zealand, we still have the third lowest cases in the world. For example, in the past week, our 7-day rolling average cases per million equal 31 a day compared to 54 in Australia and nearly 500 in the UK. But as we transition to a new phase, there will be different views. But we're moving to the same place, one where we're all safer still because of vaccination, where our businesses are guaranteed to remain open and jobs are filled, and one where we have huge opportunities ahead, whether that's seeing loved ones that we haven't seen for some time in Auckland, or travelling overseas, or just getting out and about safely. For now, though, I'm happy to take your questions, as is Dr. Bloomfield. Yeah, Jenna.
Why have you gone straight to level 2 rather than going to the final step of the phased move to level 2?
Given it's based on public health advice, I'll start with Dr. Bloomfield and pick up anything else after.
So 2 things there. The first is the team were clear in their advice to me late last week and also over the weekend, looking at the updates on cases, that it was appropriate for Waikato to move down a level. And they then looked at the option of either 3-3 or alert level 2 and felt that it was just more simple and consistent with the rest of the country to move directly to alert level 2, and so that was the advice we put through.
Just to add, of course, the advice that we're receiving from the public health teams on the ground is that you're predominantly still seeing linked cases coming through, that it's very different to the wider spread outbreak that we have in Auckland, and therefore confidence around making this decision. One thing I will again emphasise though, this is short term, as is the alert level system for New Zealand generally. We will very shortly be moving into our new framework, which marks a change in strategy for New Zealand in our ongoing campaign against COVID-19. A new framework, which means greater certainty for business, but actually in many ways, greater protection for New Zealanders.
On that framework, are you going to stick to the criteria that you outlined when you announced the traffic
So
light?
yeah, picking up the questions from both of you. So what you will have heard me indicate today is that there is a strong view coming through from the Ministry of Health that we should consider moving to the protection framework earlier, because it provides greater protection for New Zealanders than we even see with the current alert level system. So that's something we're now going out to our experts on to seek their views. Keeping in mind, we set that high vaccination rate target and that has served us well. Many DHBs are already hitting that 90% first doses, so there is the opportunity for us to get the best of both worlds. High vaccine rates, but of course the protection of this new framework. If I may, I'll finish with you, Jenna, then I'll come over because you had your question and then I'll come down the back to you, Barry.
Yeah, sorry, kind of in the same vein.
Yep.
Will that Auckland border remain in place until the rest of the country hits all DHBs?
Announcements on the way the border will be operating and from when will come to on Wednesday.
Is it fair to say then that elimination is over outside of Auckland as well?
Yeah. Look, you'll see us continue to take the same approach of extinguishing cases where we can. Why wouldn't we? Well, we've got the ability to do that, and we do. We are still seeing cases that are connected, that we can determine where they've come from. And what I want to be very clear on is that we continue to contact trace, have people isolate, exactly what we've done before. But what you're seeing is a change in our approach, is that when you see those cases, previously we may have immediately moved into lockdowns, much more so we're moving towards contact tracing as a way of dealing with those cases.
Prime Minister,
and please,
just
go
to add
ahead.
one thing there, the advantage we now have, of course, is those high and increasing vaccination rates. So they're providing, in a sense, the cover that the alert level, higher alert levels previously have provided.
Yeah.
Regarding mandates, would you consider regular testing as an alternative to vaccination?
Well, at the moment, that's not been our
Anywhere,
advice.
or you mean just generally?
Job mandates or under the traffic license?
It's not been our advice at the moment, actually, because it's quite clear that vaccination plays two important roles. First of all, reducing the likelihood someone will be infected in the first case, but secondly, greatly reducing the likelihood they will get very unwell and die, and that's material, and testing can't do either of those things.
Keeping in mind that we have, of course, been cautious in the way that we've applied vaccine mandates, very particular circumstances. Thus far, it's applied, obviously, as I've said, in schools, because actually that's a group of New Zealanders who can't be vaccinated. And we've seen from overseas experience the impact of cases in those unvaccinated environments. The second are healthcare workers, so that we can protect our most vulnerable and our most unwell. And then, of course, it only makes good common sense that if we've got high-risk environments where we're using things like vaccine certificates, it's not unreasonable to expect the workforce will be vaccinated there as well. So we've been quite careful about where we've used them.
This morning you talked about lower vaccination areas under this framework being somehow isolated. How could that possibly happen when you've got, like the Lakes District, for example, people have to drive through?
Yeah, well, actually, that was actually, Barry, what you might have heard me raise is that very point. Some people have put to us the idea of reversing boundaries. So lifting Auckland and then instead putting boundaries around other areas. Now, the fact is that we have to take into account, as we've seen with the Waikato, there's parts of the country where it's just not feasible to put hard boundaries around. They have too many entry and exit points, and there's a number of examples of that across the country. Secondly, of course, if you work in that way, you'll have more than just Aucklanders who will be caught up in those checks. So these are all questions that we've needed to work through. And on Wednesday, we'll talk in a bit more detail around where we've landed to both try and create a level of protection, but also allow New Zealanders to move over summer.
Can I also ask you about Auckland? You said when you visited there that you saw people in the hospitality industry.
Oh, informally.
On a casual basis.
Yeah.
Was it the people at Crave, or was it?
Because it was informal, I'm loath to give an expectation that anyone's speaking on behalf of industry. That would be unfair. What I will look to do on future visits is to do something a little more formal with members of the sector. And as I've always said, though, it's a bit rough to imply that anyone can speak on behalf of the sector generally, so I won't put anyone in that position.
Can't you say who you met with there?
Oh, because it wasn't a meeting. It was all, and I've never framed it in that way. I've simply said it was informal, and in the future I'll look to do something that's a bit more formalised.
Why did you? No, just one more question on that.
I'll give you one more.
Oh, thank you.
Welcome.
Why did you decline to meet with Michael Barnett from the Chamber of Commerce?
Because I was visiting a workplace that we'd asked the EMA to tee that up. We had EMA representatives there. The Chamber of Commerce had only met, I think, maybe 48 hours, possibly 72 hours before, I believe, with Minister Robertson. And this was not my only visit. So my intention is to catch up with the Chamber, I believe, on Wednesday afternoon.
Prime Minister,
Yeah, sorry, I'll come across here to
On
you,
the
Mark,
vaccines.
and then Jason to you. Or, sorry, I should hierarchy clear.
oh,
Mark.
On the vaccine certificates, the Ministry of Health website says you'll need to provide one of 6 forms of ID in order to get one. There are New Zealand and Australian forms of ID. What about people who don't have those?
So I wouldn't want to list them all off the top of my head, but they are fairly general. So, for instance, a birth certificate, driver's licence, passport. So certainly the Ministry of Health have tried to make sure that they balance the fact that you will need to demonstrate you are who you are, because this is obviously something where we're trying to make sure that we don't have any fraudulent behaviour, with the fact that not everyone, for instance, would have something like a passport or driver's licence. What we're also working through is the ability for someone to access a vaccine certificate without having to use the web-based form. So the ability, for instance, to use in-person ways to access a certificate in case there are issues with people's access to online tools.
Can you guarantee that those ways will be, set up by the time the traffic light system starts?
Yeah, so one of the things that I discussed recently was ensuring that those face-to-face options were ready to go at the same, prior to us moving into the framework, and that's the assurance I've been given. I've also given it a test run myself, including with a few of my family members who have varying degrees of ongoing experience with online forms, and I can report back it went really smoothly. My parents are going to be very disappointed I just exposed them. Claire.
If you have already made your decisions about Auckland's boundaries and the reopening and traffic lights, why are you waiting until Wednesday to announce that?
Because as is the case with many decisions at Cabinet, often we will make decisions that we then have to ensure are ready to be operationalised. Sometimes we won't necessarily take every recommendation that's put to us, and we will need to make sure that from an operational perspective that it's what we've decided can be implemented. It's not uncommon for us to give ourselves that buffer because we do make decisions in real time.
In terms of the spread of the cases around New Zealand now, are there any areas in particular where there are cases which you are more concerned about than others, and what would it take for any restrictions to be put on other regions where it's now popping up?
Yeah, one thing before we hand over to Dr. Bloomfield, even with the cases that we've seen in recent days, still either a clear link or very strong suggestion around what has happened that has allowed those cases or occurred in order for those cases to have emerged. So at this stage, again, still linking actually is a fairly strong indication that we haven't got widespread outbreaks. The one thing I would say, though, is that we do know that we will see cases in other parts of the country, and what's important is that we have that level of preparedness with good vaccine uptake, with ongoing testing in the community, and just, that confidence that the framework we've got to try and reduce down spread is the right one as well. Dr. Bloomfield, on the case?
Just one extra comment on that. So far, these cases have been able to be, isolated, identified, and we're not seeing widespread. In fact, the area we're most thoughtful about is the Waiata Upper in Masterton, because even though no cases yet reported, one of the people from Taupo had visited there and was actually at a gathering of people who had come from other parts of the country. So they're doing an excellent job of getting out through the network to get those people tested, and there were over 30 people in the Waiata Upper who were at that gathering who were tested and offered vaccination, and many of them vaccinated yesterday, which is good. But that's probably one we want to keep an eye on. But otherwise, there's nothing, and our team did a formal public health risk assessment yesterday. There's nothing to suggest that there's a need for any advice around alert levels.
Yeah. I'll just come and then back to you, Jason.
You've already said that you've got a strong view from the Ministry of Health to move to that traffic light early, but that you're seeking advice.
Yeah.
Who are you speaking to in terms of leaders or experts or groups, and what are you kind of basing that advice on? Is it just vax rates or modelling?
Yeah. So I strongly agree with the view of the Director General and the Ministry of Health that the new COVID protection framework is actually better suited for the future that New Zealand's moving into. It is designed to give greater protections in a vaccinated environment than we actually have with the current framework. So that is part of our future. We have said that we want high vaccination rates to move into it. So what we're doing is essentially just talking to some of those individuals who have helped informed our response thus far around some of our plans to move into that, perhaps sooner than some of those targets might have suggested.
Any kind of reassurance around, are you speaking to Māori leaders in this instance?
Yes, so as part of, you'll know that even in designing the COVID protection framework, we had those conversations and setting some of the targets also. And so, yes, I expect that will be part of the conversations that we continue to have.
Colleen, just on KiwiRail, what do you know about the concerns around the culture at KiwiRail?
So I've seen some of the reporting. I haven't officially been briefed. Of course, I would expect that KiwiRail would deal with any concerns around any employment matters in an appropriate way, and that should be managed at an operational level, including by the board.
We've been told the government has been made aware of concerns about CEO Greg Miller on multiple occasions. What steps has the government taken in response to those?
Again, the most appropriate place for issues of this nature to be dealt with would be within the workplace and by the management team there, including by the board.
Concern you at all? That those
I have an expectation, whether or not it's the private sector or a Crown entity, that our workplaces be a place where if the concerns exist, they're able to be addressed in an appropriate way. That is my expectation across the board.
Can I just ask you one question about...
I'll just go, if I may, Barry, I've already just set out an order.
I just want to ask...
I've bounced Jason twice.
That's
so
all right, you can do it a third time. Go ahead.
Jason's been very generous. Barry.
The new system, of course, it does create two types of New Zealand citizens, the vaccinated and the unvaccinated. Are you happy with that?
Well, I wouldn't define it in that way. Well, actually, what I said, that there are things that vaccinated individuals, yes, will be able to do, and in some environments that unvaccinated people, in order in a situation where we do have COVID in the community, may not be able to engage with. But actually, New Zealand's not alone in having set up a framework like this, because the alternative is that we actually have more restrictions for everyone. And actually, when we have vaccines available to us, why wouldn't we use them as a way to keep everyone safe?
Jason,
I don't know if I should reward you gifting your questions to others. So I'm going to come to Henry, and then you can wait a little longer.
Thanks, buddy.
Oh, for goodness sake. Jason.
Just on the timing of this movement into the new traffic light system,
Yep.
you'd given a strong indication that you were looking to do that on the 29th. The only cabinet meeting...
We've already been making decisions on the 29th. That's not new.
Well, yeah, no, but the indication today that you might go early, is that an indication that decisions could be made next on cabinet on the 22nd?
Just to be clear, early for the rest of the country would be around the 90% mark.
So those decisions would be made on the 29th, not
Correct.
the 22nd.
Correct.
Prime Minister,
Happy to clarify. Henry.
if you have advice telling you that this, that the traffic light system works better than the electrical
Yeah.
system, why not put Auckland into it now? Auckland is clearly very keen to get there.
Yeah, well, look, for the situation that we find the rest of the country, keeping in mind Auckland has very specific circumstances. We have an existing outbreak. We want to make sure that when we move into a situation where everything reopens, which is what happens within RED, everything reopens, but with protections in place. We want to be in the best possible position because there is an existing outbreak there, making sure you've got high vaccination levels as part of that.
On the redness,
Yeah.
You've indicated that Auckland will probably start in red
Yeah.
when the traffic light system opens.
Correct.
Will the rest of the country probably
That's-
start in amber? Can you talk more about how those shifts will happen? Because obviously if you're planning a festival or something over the summer and maybe you're not eligible for the backstop, then the difference between amber and red is basically happening or not.
Two things. Those decisions will be based on public health guidance, and we're expecting to receive that for the decisions that have always been scheduled for the 29th of November. What I'm indicating today is that the Ministry of Health have indicated a view that actually moving sooner rather than later when we make those decisions could be advisable, and that's what we're seeking some advice on. The second point, for events, we accept that this is a period of uncertainty, hence the reason that we have created a transition support scheme so that they've got a bit of support to push out their decision making so that they can make decisions around whether they go ahead a little closer to the time. Yeah, come to you, Joe.
Dr. Bloomfield, just on that, in terms of the COVID protection framework and the advice that you've given that you think it provides more protection and certainty, how long have you been giving that advice for, and has that advice been restricted by the fact that vaccine certificates haven't been able to make it happen?
No, and recently, Dr. Blakefield.
In fact, this was the discussion we had just yesterday as we convened to the public health risk assessment for those areas outside of Auckland and Waikato, because the cases that had popped up. And then I had a discussion with my colleagues in what's called the National Response Leadership Team that's convened by Brooke Barrington. And we talked about the fact that actually with these cases popping up in other parts of the country, in Alert Level 2, there's a lot of activity and interaction between people, vaccinated and unvaccinated, in the sorts of places where you could get quite reasonable outbreaks and transmission. Yet, whereas in the new framework, vaccination certification or vaccination passes will provide an opportunity for much greater level of protection. So that's where we first floated the idea. Actually, it would be better to move the country into the new framework because it's got a high level of protection. And I just discussed that just this morning when we had our regular sort of morning meeting with ministers.
Because I guess what you've outlined there in terms of the activity, I mean, we are already seeing obviously cases spread throughout the country, and you are going to have unvaccinated, vaccinated mixing within regions like the Wairarapa, within the Lakes DHB, Taranaki, etc. So I guess, the counter to that is if you're seeing that already and the virus is spreading and the COVID protection framework offers more protection, are you concerned it's a 2-week period before that decision will be made?
We're not concerned because we've got those high and increasing rates of vaccination. Second, our teams are geared up around contact tracing, testing and so on. But third, and you've pointed this out, the new framework does require, amongst other things, vaccination passes really to enable it. And that work is on track, it's being expedited, and people will see even this week that the opportunity to
download them,
get one's actual pass will open up, and then the only other bit that needs is the other part of it, which is actually enabling premises to be able to read those certificates is just about in place as well. So it's putting it into operation.
Joe, if I may come back though, I mean, keeping in mind level 2 still is limiting the number of people who can be in retail spaces, limiting the number of people who can be in public hospitality spaces, making sure they're seated and separated. So there are a number of public health measures. The indication we've had is going forward though, this framework offers something new again. The issue is not just, of course, the ability to present a certificate, which, as we say, the details of how to get your certificate ready to go will be ready to go this week. We also have to make sure that enough of the population have got up to that double dose standard, because otherwise you certainly would have businesses saying it's not fair to operate a system where enough of the population are eligible to be part of it, because that impinges on the ability of businesses to operate. So there's that factor as well.
Blanket has just cited the fact that we don't have the certificate to make the framework work.
That is, as I've said,
it's got to be a hindrance of some sort.
I have my certificate, and the rest of the country will have the ability to download theirs this week as well. But we do have to keep in mind the having enough critical mass of people eligible to use them. Otherwise, that does become a hindrance for business as well. Yeah, Gina.
Sorry.
Okay, sorry. We'll come to Ben and John. I thought I recognised you, John. Ben?
Thank you. I have a COVID question and a non-COVID question, that's okay.
Go ahead.
On home isolation, because obviously that's now moved to become a default or the more popular way of housing people with COVID-19, and a number of people have also died. There's some confusion around the expectation of the clinical oversight that people with COVID-19 should have. What is your expectation? Do they need to have conversations, do they need to have with doctors and nurses rather than Healthline or other health professionals?
You're asking, yeah. So look, what is absolutely critical is that we have a good understanding of someone's medical history and the potential risks that COVID-19 may present for that individual. So that clinical assessment does need to happen early on, and that conversation with an individual does need to happen early on. So yes, that is our shared expectation. That is, of course, part of the system as we speak. It doesn't mean the daily check-ins will be done by a clinician, even though Healthline has clinicians available when they do those daily check-ins. But that initial assessment is really critical.
Do you agree that's working well?
Oh, look, there is certainly room for that to be improved, certainly, and we've seen some examples, obviously, but again, I also don't want to cast judgment on what has happened in all of those cases, because we do have the coroner involved in those cases as well.
Okay. And on the non-COVID issue, because the Foreign Minister was in Australia, meeting with Maurice Payne, and she mentioned on the topic of a pathway to citizenship, she said New Zealand, quote, can present perhaps what an incremental and progressive pathway could look like. Can you be clearer about what she meant by
Sorry,
that?
could you repeat that again for me?
She said on the top.
So did you say this was Minister Payne?
Sorry, no, apologies. It's Nanai.
Okay, sorry, yeah, carry on.
Speaking about a pathway there, said, quote, can present perhaps what an incremental and progressive pathway could look like. So what is that proposal you're putting to Australia?
Oh, what we've always said, that we're concerned that New Zealanders who relocate to Australia have had difficulty on their pathway to citizenship in the past.
So no new proposal or anything, it's just
Our ongoing call for New Zealanders and their contribution to Australia to be recognised. Okay, sorry, John.
Prime
Yes.
Minister, some public service employees, including a number of Oranga Tamariki staff, are supposed to get their first jab by today. And if they refuse, I've spoken to the agency today, they can be redeployed. If they can't be redeployed...
Sorry, John, I'm not sure I could speak to this because I'm not sure this is not included in our mandates.
well, it's Oranga Tamariki's response to us today that several staff members, several types of staff members are required to be vaccinated for their role from today. Those who have chosen not to be vaccinated will be asked to
So I'll let Dr Bloomfield, I imagine that they've caught up with some of the other orders.
Yep.
So they've been told if they refuse to be vaccinated, they'll meet with their manager to discuss the next steps. They'll then either be redeployed or put on paid special leave for up to a month. So I'm just wondering how much money taxpayers should be prepared to fork out.
Let's just clarify the scope of who that applies to, because we don't have a general mandate across all of Oranga Tamariki.
Yes, it would apply to, and there are people in my organisation as well, because on the health side, it captures people who might interact with, on a reasonably regular basis, people who are providing care to others. And you can imagine in Oranga Tamariki, they will have social workers who maybe not just interacting with, but maybe in clinical settings. And likewise, I have a number of my people in the Ministry of Health who are often out in the sector and in the system and in clinical settings. So they are captured by the order. And Oranga Tamariki, like other public agencies, and many of these were already captured under the border worker testing, there is a process they will go through to have a conversation, redeployment, and if there's no opportunity for redeployment, then there'll be another process.
I don't imagine...
Fork out for paid special leave for up to a month.
Look, my view is that this would not actually be widespread. So before I give any commentary on whether or not indeed it is affecting the taxpayer, I'd like to go away and see the size of the issue. What we've found through our mandate experience is that actually, by and large, once mandates are in place and an employee and an employer works it through with an employee, for the most part, many individuals are either successfully redeployed or make a choice to be vaccinated.
Just on that,
yep.
The mandate's coming into force for the health and education sectors from tomorrow. Can you give us a picture or rundown of, I guess, how many staff may not be turning up to work tomorrow and how the sectors are maybe preparing to cope with those people? Perhaps
if I very briefly speak to education, and perhaps Dr Bloomfield could speak to health. As far as the Ministry of Education is aware, no schools have been unable to open for learning as a result of the vaccination mandate. There are currently only, we're advised, 11 schools of the 2,500 that are indicating that they have a high risk of staffing issues. So that's affecting about 0.2% of students at the moment. The Ministry of Education is working closely with schools who fall into that category to support them. We've received overall 4 exemption applications, and these are currently being assessed by the ministry and minister.
Where those schools are they all small, kind of regional?
Unfortunately, I can't. I'm sure that on making those decisions, that the minister could speak in a little more detail on that.
Do you have any idea?
And there's been a few transport services that are being disrupted, but I think that we've got that number. Sorry, just for completeness. We've got that number down quite low. I think it was 19 this morning. I think it might be lower still that are disrupted, and that's of a number of bus routes, as you can imagine.
So on the health side, we've been working very closely with District Health Board